Hey, Dr. Sean Price here. I just wanted to shoot a quick video and explain what our new remote functional medicine program is. Basically, as many of you know, for the last 7 years, we have been treating many patients that are chronically ill with things like chronic fatigue syndrome, fibromyalgia, thyroid disorders, Hashimoto's disorders, autoimmune conditions, blood sugar issues, adrenal fatigue, all of these digestive issues, all of these different conditions. We've had huge success with our patients. And we have begun a remote program because one of the biggest challenges that our patients were having was finding the time to get into our office and the cost of what the program was with the in-office treatments. So in response to those challenges that with our patients, we have developed our remote functional medicine program. So in order to explain this program, I first want to explain what functional medicine is. So functional medicine is looking at the patient as an individual person metabolically. So evaluating thyroid function, evaluating blood sugar function, evaluating adrenals, liver, gut, all these different metabolic systems in the body, they all work together in a very intricate and detailed way. So we use several processes to evaluate the metabolic status of our patients. So for example, a patient with a thyroid disorder, about 70% of the time, patients that come into treatment with us and come in that we work with typically don't have actual thyroid problems. They have underconversion due to gut and liver malfunction. They have hormone dysregulation, which is blocking the T4 to T3 conversion. They have adrenal fatigue, which causes challenges. They have different metabolic issues on the pathway that are leading to a thyroid diagnosis or leading to other issues. So we dive in deep and evaluate all of the metabolic pathways of the body. And then through functional medicine, after diving in deep with those pathways, we will design a program, a nutritional and supplement program that puts the body in a position of rebuilding and rebalancing and supporting that normal function that they've lost. And in doing so, most of the time, the patient is able to recover their function and recover from many of these conditions that they are dealing with. And a lot of times they're able to get off of medications and they are able to return to the quality of life that they wanted. So functional medicine is extremely beneficial with that. It's also beneficial with situations like brain fog, emotional disorders, anxiety, depression, because the brain and the nervous system utilize about 30% of all the fuel that's created through the metabolic pathways. So if the metabolic pathways are off, the brain's going to get poor fuel and you're going to end up with brain disorders as well. So all of these conditions can be greatly affected by balancing the metabolic processes in the body, and we do that through the functional medicine and the nutritional protocols. Now, how do we evaluate your metabolic statuses? Well, we do it through a series of a detailed history. We use questionnaires, we use labs in some situations, we use saliva testing, hair sampling, we use whatever tools that we need to be able to dive in deep and figure out what's going on. Most patients we're able to evaluate simply with questionnaires and with labs that they've had run in the past. Some patients haven't had labs run in the past, and so we just use questionnaires. It just depends on the individual patient. So that is how we do this. We evaluate you for an individual evaluation, and then we determine what is going on with you, and then we sit down with you and we put together a plan for you, and then we can treat remotely. And what this does is this saves you time because you don't have to come into the office. It saves you you can do this. Everything is done from the comfort of your home. So any conversations we need to have can be done by phone, Skype, email. It saves you time with that aspect of it, and also saves you a lot of money because we don't have the overhead of an office. We don't have the overhead of staff to support this process. So it benefits the patient greatly, and it removes those obstacles that we talked about earlier of time and money, because our treatment plans in our office were extremely expensive. Anywhere from $4,000 up to $7,000 for a treatment plan, and it's nowhere near that cost anymore. So lots of benefits with it, same great results. That's how this functional medicine program works. And all we need to do to get the evaluation done is basically you get in contact with me, with whichever method came along with this video, and I will send you all of the paperwork that you need to get started. You'll fill out that paperwork, you'll get that paperwork back to me. I will then evaluate it, and I will send you a report on that paperwork, and then you and I will schedule a phone consultation so that we can go over the findings of your evaluation and determine what the best plan for you is and move forward from there. Okay, so I look forward to hearing from you, and let me know if you have any questions.